going to go ahead and begin. I want to welcome our witnesses. Thank you all so much for joining us today. I also want to thank all of my fellow senators who will be joining, and just explain to those of you who in the audience that people will be coming and going because there are other hearings and events going on this afternoon. So please don't be offended if senators come and only stay a few minutes and then leave. This is also what we call a spotlight hearing, which I think was explained to the witnesses, but for those of you who may be new to this, this is not an officially sanctioned hearing by any committee within the Senate, but it is a hearing that's designed to raise concerns about, in this case, the issue of extending the premium tax credits to help people be able to afford health insurance. And so we are especially pleased that our witnesses are here giving us a variety of perspectives on the issue. If Congress fails to act on extending the enhanced premium tax credits, millions of Americans will lose their insurance coverage and millions more could see their costs go up. And the number we had been using was 75%, but there's a new Kaiser Family Foundation report that just came out today that suggests that that number is actually double, that if we talk about doubling the insurance premiums for folks in the health insurance marketplace, that that's probably more accurate. And the reality is that these tax credits really affect everyone, particularly now as people are looking at the rising costs of living, where families are looking at how every dollar is being spent. An increase that's as large as is being projected for health insurance could be devastating. I hear from folks across New Hampshire, and we're pleased to have one of those people here today, and Jeff Baker. They are concerned about how those costs keep rising and how President Trump's trade war and economic agenda is making things worse. It's something that I've heard from every single business that I've been to. It's a message that I heard again last week at a roundtable with small businesses in my state who rely on the Affordable Care Act to get affordable health insurance for their employees. This comes after the president and congressional Republicans passed a bill this summer that kicks 10 million Americans off of Medicaid. That was done in order to raise the money to pay a huge tax cut for the wealthiest Americans. And now on top of that, healthcare premiums are projected to skyrocket at the end of the year. We heard a couple of weeks ago from the nonpartisan Congressional Budget Office that if we wait until the end of the year, that 1.5 million people are going to lose their health insurance. So there's real urgency to extending the ACA enhanced premium tax credits and doing it now, because kicking the can down the road is going to make a real difference for working Americans. And if the tax credits are allowed to expire entirely, it means that 4 million Americans could lose their coverage and 24 million more could see significantly higher premiums. So without those tax credits, millions of Americans will have to make a difficult choice about what they'll have to live without so they can afford health insurance. I think that's unacceptable in the United States of America. So the American people should be concerned about the soaring costs of healthcare coverage, and we are here to remind our colleagues across the aisle, some of whom have publicly and privately acknowledged the importance of getting this done, that the clock is ticking. Each day we wait makes the solution harder. Waiting to act will leave more Americans uninsured, and it will cost patients more of their hard-earned income. So, again, that's why we're here today, to talk about the impact of what happens if we don't extend those tax credits and the importance of doing so as soon as possible. So thank you again to our witnesses. Let me now introduce each of them. Ms. Sabrina Corlett is the founder and co-director of the Senate on Health Insurance Reforms at Georgetown University's McCourt School of Public Policy. In her role, Ms. Corlett directs research on health reform issues and has recently authored a report on how cuts to Medicaid and the Affordable Care Act will affect Americans' health insurance plans including on the ACA marketplace. Ms. Corlett, thank you for coming. We're looking forward to hearing from you. Ms. Kristen Fuman-Simmons and her family live in Kennebunkport, Maine. She was diagnosed with relapse-remitting multiple sclerosis in 2017, which led her family to turn to the Maine health insurance marketplace for health coverage. For Kristen, the ACA marketplace was a godsend, and extending the enhanced premium tax credits is a matter of utmost urgency. We look forward to hearing what you have to tell us today. Mr. Jeff Baker is founder and CEO of Image4. Image4 is a 20-person exhibit and architectural design firm that specializes in creating immersive 3D experiences. Jeff relies on the ACA marketplace to ensure that he can help his employees afford quality health insurance while still thriving as a business. Most importantly, Mr. Baker is from New Hampshire, so it's good to see you again. Dr. Malik Joshi is the president and CEO of Meritus Health. Did I pronounce that correctly? Great. Meritus Health is a regional health system serving patients across Maryland, Pennsylvania, and West Virginia. Dr. Joshi has an extensive resume across the healthcare industry. He holds a master's degree and doctorate from the University of Michigan. Dr. Joshi, I'm glad you could join us here today. Now, Ms. Corlett, we'll ask you to begin, and we'll go right down the row. Thank you.
Well, thank you, Senator Shaheen, for the opportunity to testify before you today on an issue critical to the health and financial stability of millions of American families. In just 3 short months, federal tax credits that have helped over 23 million people access and maintain health care are scheduled to expire. This expiration, along with other federal policy changes, will dramatically increase premiums for working families, increase the numbers of people who are un- and underinsured, and destabilize insurance markets that have, until now, experienced a period of remarkable stability and growth. I am here to share findings from an analysis that we published earlier this month, reviewing 178 insurance company regulatory filings detailing their projections for the insurance market in 2026. Any views that I express today are my own and do not reflect those of Georgetown University or the McCourt School of Public Policy. The ACA marketplaces are a critical source of high-quality, comprehensive health coverage for Americans who cannot access insurance through their employer and do not qualify for public programs. Marketplace enrollees include self-employed entrepreneurs, gig economy workers, freelancers, small business owners, early retirees, and more. These individuals and their families depend on the marketplaces as a stable and affordable source of insurance coverage. Approximately 93% of those enrolled in the marketplaces are eligible for premium tax credits. On average, they will face a 118% net premium increase if enhanced premium tax credits are not extended. However, these premium impacts will vary depending on family income, geographic location, and age. So for example, a family of 4 earning $50,000 per year living in Nashua, New Hampshire will see their premiums increase by almost 2,000%. 2 retirees living in Kaukauna, Wisconsin, earning $85,000 per year will see their premiums jump 250%. And a 28-year-old living in Hillsboro, Oregon, earning $25,000 will see their premiums increase by 1,113%. Perhaps counterintuitively, the end of the enhanced premium tax credits will also raise premiums for people who are not eligible for those tax credits. Senator Shaheen, you and several of your colleagues asked our center to review the materials that health insurers have submitted to support their proposed premium increases this year. Insurers in the marketplaces make decisions about participation, plan design, and project future premiums based on healthcare costs, competitive considerations, and the policy environment within which they must operate. Our review of these regulatory filings found that the primary factors driving the premium increases in 2026 are the expected expiration of enhanced premium tax credits as well as increasing healthcare costs. Insurers expect enrollment to decline significantly. They also expect that healthier individuals will be more likely to drop coverage, and remaining enrollees will be sicker on average, driving up average medical claims costs and premium rates. CBO has projected that 3.8 million people will lose their health insurance if Congress allows the premium tax credits to expire. The consequences of being uninsured are well known: delayed care, foregone care, worsened outcomes, increased medical debt, and uncompensated care for providers. For those who manage to hang on to their insurance, they may need to switch plans to plans with higher deductibles, increasing financial barriers to care. Others will be forced to sacrifice on rent, food, and other necessities. Those most likely to make those sacrifices are people with high-cost medical needs, resulting in a smaller and sicker risk pool for insurers, even higher premiums, and fewer plan choices. Thank you for your time, and I look forward to your questions.
Thank you very much. Ms. Furman-Simmons.
Thank you so much, Senator Shaheen, and everyone here today. It is a true privilege for me to be able to share my story and talk about the reauthorization of the Affordable Care Act healthcare tax credits. My name is Kristen Furman-Simmons, and I live in Kennebunkport, Maine, with my husband, Mark. I'm a wife, a mother, an artist, and a teacher, and I'm also a patient. Since 2010, my husband and I have been the primary caregivers for my father, who has chronic lymphocytic leukemia, and he's now in end-of-life care. His disease and his treatment have shaped our family's belief in the universal need for affordable and accessible treatment. While my father's care has not been covered by the Affordable Care Act, mine has, and it has made all of the difference. In 2017, while I was running a fundraising road race in honor of my father, I suddenly lost vision in my right eye and mobility on the right side of my body. What I thought might be the flu or exhaustion turned out to be multiple sclerosis. An MRI revealed multiple demyelinating lesions in my brain and dangerously elevated brain pressure. Since then, I've required constant and complex care. I regularly visit my neurologist. I have MRIs twice a year. I get yearly spinal taps, quarterly eye exams, and routine consultations with specialists across the state. My medication regimen is equally complex. I take something called Diamox, which is typically reserved for mountain climbers to help them at altitude sickness. This also helps to reduce pressure in my brain. This treatment, however, long-term causes the loss of essential vitamins and minerals, which also necessitates daily supplementation and quarterly IV treatments. With insurance, my medications cost $230 a month. Without it, those medications would be unaffordable. A single spinal tap in the state of Maine right now is being billed at $2,300. An MRI averages at $4,800. These are not occasional expenses. They are essential and ongoing parts of my life. In 2023, I had to leave my job as a lecturer at the University of Southern Maine because of the toll this disease has taken. Today, I am 51, the mother of 2 extraordinary grown daughters, and married to a man who has dedicated his career to supporting families with mental health needs. We live simply on a very tight and exacting budget. Our annual household income since I left my job averages at $41,000 a year, which qualifies us for a significant ACA premium tax credit and significantly reduced deductibles. Even with this support, over the past 8 years since I've had this diagnosis, I've accumulated $20,000 in medical debt. Thanks to the enhanced premium tax credit, I pay just $11 a month right now for my premium, which is pretty amazing. But now, looking at the numbers, and of course my numbers are based on information I had earlier, but we're looking at over $2,000, or if not double that, for our premium for the year, which would be completely untenable. Losing this coverage would mean losing my ability to see, losing my ability to walk, and be able to live with dignity. Time is running out. In the coming days, families across Maine and across the nation will begin to receive these letters letting them know about their premium increases. Millions of people like me with chronic diseases like blood cancer or MS will begin to ask questions like, do I stay on my medication or do I pay my mortgage? Do we keep our health insurance or do we risk blindness, disability, or even worse? These are gut-wrenching decisions, and no family should ever have to make them. It is no small thing to weigh the value of your life against the access to affordable care. It is an agonizing burden to know that your ability to survive depends not just on your doctors and your treatment, but whether or not you can afford your health insurance premium. The Affordable Care Act and its enhanced tax credits make it possible for me and for millions of others. More than 50,000 Mainers alone rely on this support. Affordable coverage for us is not a luxury, it's a lifeline. That is why I'm urging you and the colleagues that are here today to act now to extend these healthcare credits in 2026 and beyond. Please protect patients like me so that we can continue to watch our children grow, care for our elderly, and contribute to our communities. Thank you for listening to my story and for your leadership.
Thank you so much for being willing to share
Thanks.
with all of us what you're experiencing. And can I just clarify, you said that currently with the premium tax credits, your premium is $11 a month,
That is correct.
and it would go up to $2,000?
So what 2,000 is the approximation for the year cost.
Okay.
So that was based on the numbers looking at 75% increase. So right now, we pay roughly $150 a year, which might not seem like a lot to a lot of people, but living on that kind of budget is very, incredibly tight. So based on that current calculator, we were looking at an over $2,000, payment.
That's what I was trying to clarify, if
Sure.
that was for the year or for the month.
Yes, thank you.
Thank you. Mr. Baker.
Thank you for the reminder to punch the button. Thank you for the opportunity to testify today and share the perspective of small business owners across the United States as well as in New Hampshire on the value of the Affordable Care Act and the enhanced premium tax credits. As you've heard, I'm Jeff Baker. I'm CEO of Image4, about a 20-person exhibit and architectural design firm in Manchester, New Hampshire. And some of you may have seen our work in the Marine Corps Museum or the International Spy Museum, so we're not unfamiliar with the area. We have a 40-year history of contributing millions of dollars to our staff, our partners, our vendors, and our communities across the country. We work across the nation. Small businesses are the backbone of the American economy. We bring innovation, we bring adaptability, we bring local investment. Unlike large companies, we don't have a great deal of bargaining power. We have difficulty negotiating lower prices for materials, which is certainly a strain on the business right now. And we very much don't have the horsepower to negotiate lower prices for health care. For 37 years, Image4 has offered health insurance to our employees. And every year, I just can't wait to see the premium renewal rates. This year was the worst year out of 37 years, a 34% increase in premiums in 1 year. We've played the whack-a-mole game between health insurance for years and years now, trying to manage our input premium costs from one insurer to another insurer to another insurer, which has created a lot of stress for our staff, created a lot of extra work for my office manager, and it has controlled our premiums, but a 34% jump is unsustainable. Puts pressure on the wages, it puts pressure on our growth, our employee retention. For context, our average monthly premium right now is about $450. 60 to 75% increase, which we were dealing with last week, would raise that to nearly $700 a month, and obviously 100%, 150% increase is basically catastrophic. My employees, who are generally early professionals, they're well compensated, they're not earning three figures in our industry, would see their premiums rise from $225 to now we're talking $400 to $500 a month. For many of them, that's a car payment, half a week to a week of daycare. In New Hampshire, it's a quarter of your rent because our rent is ridiculously high. it really, really matters to the staff. In 2025, the ACA plan offered much better coverage for us at a lower price than our commercial options. We moved to the ACA exchange. We cut our premium costs by 33%. So we came up basically even on 2 years ago premium. We also managed to move our employees from bronze to silver plans. So much better coverage, the option for dental, which did not carry. My employees and I now, as someone in the AC pool, are very satisfied with this. Again, my team ranges from 21 to 76, but most are mid to early career, and they are doing what we all aspire to. They're buying first homes, they're starting families, they're trying to get ahead. They're facing crushing costs everywhere, in housing, in childcare, in food shopping, in transportation. Affordable health care is a large help in making a tangible and positive difference in their budgets and lifestyle. I believe in building a business and generating profit. I'm a capitalist. I also know that when my employees are healthy and secure, they're more productive. I spend less on turnover. I spend less on health care. That allows me to reinvest in growth and pay more taxes, but it's good for everyone. And healthcare is not just a financial issue, it's an emotional and a personal and a societal issue. If we want strong communities, a competitive workforce, and a thriving small business sector, we must ensure affordable access to healthcare. Thanks for your work on this critical issue.
Thank you very much, Mr. Baker. Dr. Joshi.
Senator Shaheen, thank you so much for hosting this Spotlight Forum. I'm Malik Joshi, President and CEO of Meritus Health, and I appreciate the opportunity to be here today. My organization includes Meritus Medical Center, a 327-bed Level 3 trauma teaching hospital, the Meritus School of Osteopathic Medicine, the first new medical school in Maryland in over 100 years, and designed to train physicians to take care of patients in rural America, and Brookline Psychiatric Hospital, which provides needed mental health services throughout the state of Maryland and the region. We are a not-for-profit health system. We have over 4,000 employees and serve over 200,000 people in southern Pennsylvania, Washington County, Maryland, and the Panhandle of West Virginia. We are very focused on community needs. 2 examples. We provide free transportation to anybody in our county to get to a medical appointment, and we provide over 15,000 free trips a year. A second barrier is healthy foods. So we've started a food pharmacy where physicians can prescribe healthy food for their patients, and it goes into the electronic health record, and we follow up, and it's pharmacy with an F because we use locally sourced fruits, vegetables, and dairy as much as possible. We know one necessary element of a healthy community is its residents' access to meaningful, comprehensive health insurance coverage. You know the numbers, and I thank my fellow panelists for echoing many of these. Approximately 90% of U.S. residents are insured, with significant gains in the last 5 years. Health insurance facilitates access to care, which means better health outcomes. And on the other hand, people who lack insurance or are underinsured often delay needed care and rely more heavily on the emergency room, which means scarce resources being spread throughout and impacting everybody in the community. Senators, many of you were instrumental in passing the 2021 law that allowed additional eligibility for enhanced premium tax credits to help certain individuals and families purchase insurance in the health insurance marketplace. That change was impactful for rural communities like us who tend to face higher premiums and fewer coverage options. This was really critical, but with these credits expiring, there are going to be 3 major impacts. First, millions will lose coverage, as you've heard. This is significant, with the Congressional Budget Office estimating as many as 4.2 million people becoming uninsured by the year 2034. Now, in Washington County, Maryland, the per capita income in our county is under $60,000. The national average is over $70,000. And chronic conditions in our county are profound. 1 out of 3 people in our county have high blood pressure. Over 70% are considered overweight with a BMI greater than 25, and 40% have a BMI greater than 30, and 1 out of 10 people have diabetes. These numbers are similar for many rural health communities, and insurance coverage is critical for access. Analysis by the K&G Consulting for the American Hospital Association shows that most rural states in America would experience on average a 30% decrease in marketplace coverage and a 37% increase in their uninsured populations. Second, the cost burden on individuals and families will increase substantially. You've heard the numbers. They are significant percentages. Third, providers like Meritus will experience an increased financial burden, which could impact our ability to provide all services to everyone. For a healthcare organization like us, people delay care because of lack of coverage, and they go to the emergency room. And when you go to the emergency room, there are more effective and better settings of care that are going to improve your health outcomes. And for us, like a trauma center, that's moving scarce resources to other parts. So for us, this is critical, and we urge you to work to enhance the premium tax credits. And we know how critical it is for access to care, not just for those with the coverage, but for everyone in our community that will be impacted. Thank you.
Thank you very much, Dr. Jassy, and to each of our panelists, thank you all for being here. We have been joined by Senator Tammy Baldwin from Wisconsin and Senator Angus King from Maine. So, Senator King, you have a constituent here.
I understand.
And because we have a time schedule that we're trying to follow, I'm going to defer my questions to a time when there may not be other senators here and call on Senator Baldwin to begin.
Thank you so much. And I want to thank you, Senator Shaheen, for holding this important forum today. It is vital that we get the word out, and I appreciate all the folks who are here testifying. And I'm also proud to be your partner in this effort to secure a permanent extension of the enhanced premium tax credits. For months, I've been traveling around my home state of Wisconsin, listening to families, to parents, to small business owners, to people who are caregivers for loved ones, to doctors and nurses and others, and talking about how these tax breaks make all the difference in being able to afford affordable care and good care. Enhanced premium tax credits ensure that tens of millions of families can buy affordable coverage through the Affordable Care Act. But as you've heard, and as you know, Republicans are poised to strip them away from American families, causing probably around 4 million of our neighbors, our friends, to lose health insurance entirely. And they estimate that 22 million will face a premium increase on average of about 75%. Ms. Furman-Simmons, thank you so much for being here today to share your story and what it will mean to you and your family if Republicans do refuse to extend these tax breaks. Your story is a prime example of why we have to act with urgency. Families cannot be left wondering if they are going to need to decide between their mortgage or rent or food and needed health care. And if these tax breaks aren't extended, patients who are struggling to afford insurance may be forced to purchase a plan that provides less coverage or mandate that they have a different set of providers rather than the team they might have worked with, and may even be at a much higher cost than they pay now. So what would it mean for medically complex patients like yourself who need that consistent care, that consistent team managing your care?
Thank you, Senator Baldwin. That's a great question, and I'd love to answer that with a quick anecdote. I was recently asked, Kristen, could you just ask your neurologist to put you on a cheaper treatment? And it struck me as a little bit funny. I said, I actually already have. I've asked her to help me be on something that is as streamlined as possible. And it's pretty interesting. In cases like mine, MS or chronic diseases like cancer, Most of us have very targeted treatments that are very specific to us. In the case of MS, many patients have 1 to 2 treatments before they land on something that's very effective for them. And this comes together from a group of neurologists, your primary care, endocrinologists, a whole group of people who are really working together. So it actually took me 4 different treatments before we landed on something that was very effective in terms of managing the demyelinating nerves in my brain, and also for the brain pressure. And it also happened to be one of the most cost-effective treatments that there was available in the MS marketplace. There are biologics that are fantastic for people. I ended up with a very old-fashioned treatment that was very affordable, actually sort of cheap when we look at it in the world of MS. However, this is as low as it goes. I'm already on a generic medication. I can't get a generic spinal tap to help siphon off fluid, right? There's no other way to do that. And it's pretty interesting. I have already, in answering this woman's question, I look at how many areas of my life that I've negotiated cuts. For example, my husband and I, having 8 years in of treatment, we've already called our mortgage company and negotiated and refinanced for a lower rate to try to afford our care. We're 51 and 52 years old. We have cashed in all of our savings. My husband and I have a retirement account that is about $6,000, right? We are staring down our retirement with a very small nest egg because we have cashed in some of our accounts to help pay for care. There is no safety net for us. We both drive 15-year-old cars, right? And it's one of those things where I say, what would a 75%, and now we're understanding from the Kaiser Family Foundation that it's going to be around 118% increase. We have a contingency budget in our very tight family plan that allows for some emergencies to happen. Those are things like if a car breaks down, if we need a new appliance. We do not have a contingency budget for if I have an emergency and our premiums go up. So that's the kind of impact that it would have on us.
Thank you so much. I appreciate that.
Thanks very much, Senator Baldwin. We've also been joined by Senator Wyden from Oregon, and I have you as next on the list, Senator Wyden.
Thank you very much, Senator Shaheen, and thank you for all your leadership over these many months. I'm sorry I missed some of your testimony, but I've had a chance to get briefed on it, and I want to talk about the insurance industry. Open enrollment begins on November 1st, just over a month away, and rates are going to be finalized in a matter of weeks, if not days. As far as I can tell, and this is an area I've specialized in since my days as director of the Gray Panthers, it looks to me like most insurance plans have still not taken basic steps to inform their enrollees of the catastrophic financial hit they're about to take. Ms. Corlett, you are an expert in this area. What's your take on the insurance industry? Haven't they seen this crisis coming all this year?
They have, Senator Wyden, and thank you for the question. As you may know, the Centers for Medicare and Medicaid Services, CMS, informed insurers this summer they didn't have to give people advance notice of their premium change, but I believe they have a responsibility to do so and to do it well before open enrollment starts. The expiration of the premium tax credits is going to be such a huge financial hit to millions of American families and to their enrollees. These insurance companies have a responsibility to give their enrollees as much time as possible to understand what is coming and to consider their options. People need time to make really, really big financial decisions. Right now, it is possible that many marketplace enrollees won't learn about their premium changes until it is too late for them to make an informed decision.
What are the implications of this too late? Because it looks to me like you and I are in agreement that the decision to leave enrollees in the dark has a real impact on working people and families. What are the implications of the information really not getting there until it's too late? As I understand it, you don't just get to come in later on and everything's just hunky-dory and it's the way it was when you could have gotten it if it was available early. So walk us through a little bit of this, because you're an expert in this field, and I haven't followed every aspect of it in the last few months, and Senator Shaheen's been our leader, but I'd like you to walk us through just how this would work and affect them, and to the extent you can, others, because this raises people's cost further down the road.
That's right. So many people who are currently enrolled in the marketplaces are perfectly happy with the plan they have. They're happy with the premium they're paying. And so they may not go to their account on healthcare.gov or in the marketplace to check and see what their premium might be for 2026. Just like many of us with employer-sponsored insurance, if we like what we have, we just sort of roll it into the next year. So that's what many people in the marketplace do. They just sort of roll into the next year. They won't get their first premium bill for January until late in December. At that point, it very well could be too late for them to change plans. Say, for example, if they're in a gold plan, to change to a bronze plan if they want to pay a lower premium. They will have missed their window. If they don't see their premium change until January, they've completely missed open enrollment, and they may have to wait an entire year, or they may drop coverage completely just because they can't afford the premium. So these are real-world implications for folks if they don't learn about the premium effect until late in the open enrollment period.
Well, I don't want to take others' time, but Senator Shaheen, under your leadership, I think we ought to step in and do everything we can to protect people right now, because there are real consequences of folks being in the dark, folks being blindsided if they don't know what's going to happen between now and open enrollment beginning. And I thank you all for your leadership, and reminds me of the days when I got started, and appreciate all you're doing.
Thank you very much, Senator Wyden. I agree. We need to do everything possible to ensure that, A, people are aware of what's coming, and B, that there is an opportunity for us in Congress to fix it in a way that helps people. Senator King.
Thank you very much, my neighbor from New Hampshire. I want to tell a quick story about why I'm here. 50 years ago, I was one of these guys. I was a staff member here in the United States Senate. I had health insurance for the first time. I was in my late 20s and had my first routine checkup because I had health insurance and it covered a routine checkup. I hadn't had one in 8 years. I had a routine checkup. The doctor noticed a mole on my back, said, "I don't really like the looks on this thing, let's take it off." It turned out to be malignant melanoma. I had significant surgery, and it saved my life. Those of you that know about malignant melanoma, you catch it in time, you're okay. You don't catch it in time, you're gone. It's always haunted me that somewhere in America that same year, there was a young man who didn't have health insurance, who didn't get a checkup, who didn't catch malignant melanoma, and he's no longer here. Health insurance means the difference between life and death for thousands, if not millions of people. That's why I don't understand the impulse to limit or take away health insurance for people, and that's why I think this is such an important hearing and such an important topic. Kristen, I really appreciate your coming from Kennebunk, and I think you've testified, and I read your testimony, I wasn't here, but I read it last night, that basically if this significant rate increase comes about, you don't have any place else to look. You don't have anywhere else to go for that money, correct?
That's correct. We are in that place of dire straits. It's one of those things where we have exhausted everything that we have in terms of our savings.
And we're not talking about something that might happen, a health emergency. Most of us think, well, we have insurance because of something might happen next year.
Correct.
You have it because you're in the midst of an ongoing health emergency.
That's correct. And in order to maintain stable levels within both my brain pressure and help with my brain in terms of keeping my nerves from breaking down even more, I'm on this very strict regimen. And even with that, there are times when I have what's called an MS flare. So there will be times of inflammation where I will start to lose vision again, and I have to raise up my amount of
This
medication.
all started when you noticed loss of vision in a running race, wasn't it?
That's correct. I was running a road race in honor of my father, and I was running it was almost a 16-minute mile. Let's just call it walking, right? But I was going very slow, and I realized I'm not feeling well, and I started to lose that vision in my right eye, and then I started to drag my right leg, and that's when I found out.
And I think the important thing is your story is compelling and important, but you represent millions of people across the country. This is not something isolated to Kennebunk, Maine. And Doctor, I want to turn to another. I mean, there are two aspects here. One is the impact on people, like Kristen, but the other is the impact on the healthcare system. The estimate we have is that this, if we don't extend these tax credits, it'll take almost $40 million, basically suck it out of the healthcare system in Maine. We're a very rural state. We have a lot of very small hospitals that are hanging on by their fingernails. And I think you testified, but I want you to verify that I'm right, that there's a significant risk to the healthcare infrastructure, and there are two sub-problems with that. One is, of course, the people who don't have coverage anymore. But next is, if a rural hospital closes, everybody in that area, whatever their source of insurance is, loses the access. And in many of our towns in Maine, the hospital's the biggest employer. So it's a triple whammy. And am I correct about that?
Senator King, you're absolutely correct. Insurance.
Let the record show that that's what I like.
Insurance gets to access gets to care, and care gets to health. You cut that insurance, you're putting people's health at risk. And you're absolutely right. In the hospital world, we are the anchors for our communities in rural counties and rural communities all throughout the United States.
But as I understand the law, you don't have any choice. If someone presents themselves at your hospital for emergency care, you got to take care of them.
We take care of them, and if they come for a sandwich, we take care of them. We take care of everyone who comes to the emergency room regardless, and that makes it difficult on every single
So
person.
it's not like cutting insurance is saving money. What is really doing is shifting the cost to a hospital and to the other payers whose rates are going to go up because you have to find that revenue somewhere.
That is correct. That cost is going to everybody.
By the way, extending these tax credits, this is a little esoteric, won't really cost anything. You know why? Because it's current policy. That's what my Republican colleagues argued when they were passing that ridiculous bill last spring, that the tax cuts were current policy, therefore they didn't cost anything. This is current policy, and therefore if they extended it, wouldn't cost a dime, right, Ron?
Not a cent.
Chairman of the Finance
I
Committee. But I want to thank you all for coming here, because this is it's so important, and somehow we have to communicate this to the broader public and to all the people in this building who are making these policies. Thank you. Thank you, Mr. Chairman. Madam Chairman.
Thank you very much, Senator King. And I just want to pick up on the issue of facilities closing, because in New Hampshire, we've already had 4 facilities close. And the reasons cited were policies. 3 of those were based on the passage of the president's big, beautiful, what he calls big, beautiful bill, what I call the big, beautiful betrayal of the American people. So it's already happening, and it's happening because of those policy decisions. I want to, Senator King talked about.
I have to go to an Intelligence Committee meeting. I'm sorry. I would take you with me, but then I'd have to kill you.
That applies to everybody in the audience. Senator King talked about the impact on health systems and on individuals, but Jeff, can you talk about in your statement, you talked about the importance of health insurance for retention for your employees and about what happens to small businesses without that. Can you elaborate on that? What do you see happening if you're not able to continue to provide help your employees with health insurance?
I'll focus my analytic mind that was trained in magical math around budgets. New Hampshire has, unfortunately, an out-migration of young people. We've had this experience for about 30 years now, and we have a limited hiring pool, for sure. It's difficult to acquire staff right now. And it's difficult to retain them because we're a 20-person employer, and there are any number of 100 and 200, and if you talk about BAE, 4,000-person employers who have the option of either self-insuring or negotiating rates. We work extremely hard at putting together attractive employment packages. Good salaries, very flexible PTOs, time off for care for children and adults, and part of that package is contributing to the health care. If quite honestly, if I see the rate go up the way you're talking about, I'm going to have to look at a budget number that has to be reduced somewhere to be able to afford what we're offering, and or raise prices, which have already been raised significantly. We bring metal in, we bring in plywood, both from overseas, and the tariffs have clobbered us and our clients downstream because of that. It puts a tremendous squeeze on a manufacturer where our margins are half that, perhaps, of a software manufacturer. Quite honestly, I'm going to go back to the office and I'm going to gather the team and sit them down and give them a heads up on what potentially will happen in November. And I suspect there's going to be some really, really scared staff members. I'm thinking particularly of one employee earns $85,000 a year, which is a decent but not fantastic pay in New Hampshire now. Just had his first child. He's saved for a number of years to get into a house. His wife works. They're building a family. They're building their version of the American dream. You take, it's going to be roughly $18,000 a year out of his pocket. That's got a significant effect on an $85,000, $90,000 salary. Where does that money come from in his pocket? We're not having a great automotive industry right now due to incoming expenses. That's a new car option. So, he's got to find where that money comes from. Is it going to be reduced health care? No, he's going to care for his child.
Thank you. Ms. Corlett, one of the things that we've heard from some of our Republican colleagues in explaining why they don't want to extend the tax credits is because they claim there's rampant fraud and abuse in the program, that we're helping mostly wealthy people who could afford health insurance on their own. Can you talk about what you've seen in the health insurance market with these tax credits, both whether you're seeing rampant fraud and abuse and the income levels of the majority of people who benefit?
Yeah, sure. And I actually can just cite for you the Joint Committee on Taxation, which, as you know, is a committee that advises Congress. And there is nobody right now in the marketplaces, nor has there been anybody making $500,000 or $600,000 a year who is getting these premium tax credits. These are really going to lower and moderate income folks. 94% of people in the marketplaces earn less than $200,000 a year. Half are earning about $31,000 for an individual or $64,000 for a family of four. I mean, we are really talking about early retirees, entrepreneurs, freelancers, gig economy workers. These are folks who are hustling. They just, for whatever reason, aren't getting a plan through their employer. But they really are the engines of our economy.
Thank you. And what about fraud and abuse?
Yeah, sure. Absolutely. So there has been some fraud in the Affordable Care Act marketplaces, largely the result of a system vulnerability in healthcare.gov that some very unscrupulous insurance brokers were taking advantage of. I applaud Senator Wyden and his colleagues for introducing a bill that would really make sure there's more monitoring and oversight and holding these brokers accountable. However, since this was discovered, CMS has instituted several controls that have significantly reduced the fraud. I would also say that there have been arguments that the enhanced premium tax credits are somehow causing the fraud. We know that's not true because in the state-based marketplaces that had security measures in place, there has been no fraud. So it is really, it is like saying that when there's a problem with car theft, we should take people's cars away. That just doesn't make any sense. So I think the whole notion that somehow enhanced premium tax credits are causing the fraud is just a complete fallacy.
Thank you. Let me now welcome Senator Jeff Merkley, also from Oregon, and turn over the questioning to Senator Merkley.
Well, thank you, Madam Chair, and thank you all for bringing your expertise to bear. It's quite possible I'm about to ask questions that my colleague from Oregon has already thoroughly explored, so I apologize. We live in a pretty crazy world here as we move from hearing to hearing and group to group. But I wanted to start with a question for you, Dr. Joshi. Markey and Schumer, Wyden and I had received data from the Sheps Center that's in response to a question we had put out, and what would happen with the impacts of the cuts to Medicaid in terms of the funding for rural clinics and rural hospitals. And this is a particularly concern in my state, as it is, I suspect, a pattern found throughout the United States, that the rates, that rural incomes are lower, so we have much higher participation in the Oregon Health Plan, our version of Medicaid, in the rural areas than in the cities. And I was very struck by how we now have 1 out of 3 Oregonians on the Oregon Health Plan, and 60%, or 3 out of 5 of the children. And that's a huge percent. And so it made sense that we would see an impact. When we expanded Medicaid, we saw rural clinics and hospitals add services. But over the last 2 years, we've started to see a contraction, even with the expanded Medicaid in place. And we, particularly in maternal care, and Baker City in our state lost its maternal care unit, which means if you're having a baby in Baker City and it's the middle of winter, you have to drive 70 miles through a snowstorm or ice storm in eastern Oregon, you're very, very worried that you will not make it to a delivery unit in time. So back to my question, the Sheps Center estimated that 300 rural hospitals across the U.S. would be at disproportionate risk of closure or significant program reductions. Is that a reasonable estimate? Has it been supported by other analyses across the country that the impact on Medicaid could really hurt the revenue flow? And the reason I ask this question first is because if you're in a rural, I come from a very rural small town in Southern Oregon. If you lose your clinic or you lose a significant program at your hospital, be it your emergency room, be it your maternal care room, maybe it's your mental health support system, maybe it's your drug addiction rehabilitation program. It's not just the folks who have Oregon Health Plan that don't have, it's like everybody in the community has just lost a very significant source of health care. So is the Sheps estimate based on, is it a good analysis?
Thank you for your question, Senator Merkley. I would say, first of all, you're absolutely right that health systems in rural counties are the anchors. They are the community resource in many ways and the largest employer. They are operating on razor-thin margins and negative margins. And so as you think about these cuts, the premium credits and others, it is significant impact on the health system. I can't speak directly to that study, but I can tell you there are hospitals throughout the United States looking at services, looking at everything to try to continue to take care of everyone in the community. Because you're right, It's not just those who are losing coverage, it's everyone in the community that loses coverage, loses the access to care. In our county, by the way, we have a urgent care mental health clinic. If you want urgent care for mental health, you can come to us. If that shut down, there is no other in our county, and you would have to go elsewhere. And people have a challenge in transportation and going elsewhere. So these are putting everybody at risk, these cuts.
Well, thank you. Everybody at risk, that's the phrase. And Ms. Simmons? Hi. I was checking to see if I am calling you Dr. Simmons or Ms. Simmons. I couldn't find it quickly enough, but welcome. Thank you. Delighted to have you. Medical debt. This is something I've been very concerned about for a long time. We are the only developed country where we essentially have bankruptcies from medical debt. It's improved some because we got higher insurance coverage. In Oregon, we reached 97%. That's kind of the peak. It's going to be going down now, but even people who had insurance were often underinsured, and the cost of health care is so high that even if you're paying 20% of the cost with insurance, you may still be bankrupted by it or in deep debt. And the stat I have is that it now accounts for $88 billion of consumer debt. And you mentioned in your testimony that even with the support of the enhanced premium tax credits, your family carries, I think, $20,000 in medical debt?
Yes, Senator, thank you for the question. Yes, we do.
So if we look forward and the premium tax credits are slashed, how might that affect, given that there may be other medical issues coming up and more costs incurred, how might that affect the burden that's on your shoulders from medical debt?
Sure, thank you. That's a very good question. If we have to move to a bronze plan where I have to pay more out of pocket and I have to wait to pay that, luckily I'm in a position in the state of Maine where Maine Health that I work through has been very helpful in terms of my paying back that debt. As long as I'm paying, they haven't come after me or sent me to collections, and I'm very happy that the communication is fantastic, but that doesn't necessarily make that debt go away. If we have to move to a different style of plan just to be able to afford it, I know that our debt will increase. I know that the cost of treatment will necessitate, my out-of-pocket costs will go up, my family maximums will go up, things like that. So we are already operating on a razor-thin margin, and we are operating around the understanding that my husband's in good health, my daughters are in good health. If something happens for them, it would be very difficult for us not to have to wait and apply for another payment program with the hospital and put the burden on the hospital and then also accumulate long-term debt for us. So, yeah.
So the debt is a burden, but in ways you have benefited from the cooperative relationship that many families don't get, and that medical debt then becomes reported to their credit, which means that if they try to borrow money for a home or they try to borrow money for a car, they're paying a much higher interest rate.
That's correct. So on the proviso that I keep paying, I have not had to go down that road. I have, in the past, had to dig myself out of that. So that has been a problem, and I know that that's something that is very real for many people. Currently, with that debt that I carry, I have a payment plan with Maine Health that is amenable and works out. So it's one of those things where I know if we had an emergency, I don't know that I could maintain that current payment plan. And then I would be thrust into that system where I would be getting collections calls.
Thank you very much. And medical debt is a huge ongoing feature despite the progress we've made. I'm going to yield to my arriving colleagues. Thank you.
Thank you, Senator Merkley. Let me recognize Senator Hassan, who is my colleague from New Hampshire, who just joined us for questioning, but also recognize Senator Blumenthal from Connecticut, who will be after Senator Hassan.
Well, thank you, Senator Shaheen, for convening this discussion and for your advocacy for the extension of these premium tax credits. And to our participants, thank you so much for being here today. Mr. Baker, I thought I would start with a question to you. Small businesses like Image 4 are the backbone of our communities in New Hampshire. The expiration of the enhanced health insurance tax credits have already forced insurers to increase the monthly premiums that they will charge families in 2026. In your testimony, you shared that your employees' premiums will increase by about $125 per month, from $225 a month to $350. Mr. Baker, as a small business owner, how do you see the burden of rising health insurance costs harming your employees?
Thank you for the question and welcome. It's nice to be here with other New Hampshireites. We're
Yeah.
all struggling with the same thing.
Yeah.
The vast majority of my staff are early career, mid-career. They're being compensated well, but we are not a software organization. We don't have the margins that the software company might have. We're a manufacturer. They are beginning to aspire to the American dream. They're beginning to have homes and children, and all of this is a cost that they've chosen to take on, but it's what we've done here for 200 years.
Right.
So they're going to have to make some choices. And I think Senator Shaheen has brought some new numbers awareness to me, and quickly in my head, I think it's going to be closer to $500 a month.
Yeah, that's what the new studies are showing, yeah.
That's going to be extremely difficult, especially for my 23-year-old
Yeah.
in the staff. You know, my senior staff, they're getting up to the Medicaid or Medicare age.
Yeah.
That's another challenge.
Yeah.
So, you know, we're going to have to look at some economic transfer in a macro sense.
Yeah.
You know, where this disposable income would be going otherwise into our communities is now going into supporting the cost of health care. What does that mean macroeconomically for New Hampshire? We're probably going to be okay. We're a vibrant state. We've got a very good economy. There are some states out there who are not that blessed. So, you know, wealth transfer is not really happening. It's going to be wealth absorption.
Yeah.
And we have a limit to what we can charge for our product. Our clients will cancel projects, and we've seen some of that already happening. So I think in a macroeconomic sense, it's hurtful. In a microeconomic sense, it's catastrophic.
Yeah. Yeah. And I assume that the struggles that your employees may have, for instance, if their premiums go up to $500 a month, means impacts on your business too, in terms of what they now want to ask for wages, for instance.
Absolutely. We were very fortunate to get through COVID profitably. There's not many who can say that.
Yeah.
We retained all our employees. It was a scary decision, but turns out to be the right decision. We have a tremendous loyalty among the staff. We've got a great esprit de corps. But esprit de corps doesn't put food on your table.
Right.
And at some point, we're going to have an upper limit to the salary we can pay.
Yeah.
That's based all on what we can charge.
Right.
We're being affected by the tariffs right now. Some of our raw material input costs have risen 30%.
Yeah.
We're, like so many businesses, attempting to defray that with our clients. So again, our margin is being squeezed. At some point, I'm going to have to charge more. I'm going to have to give less, and otherwise the business is not sustainable. We've been here 40 years, and we've been fortunate to put millions and millions of dollars into our local communities. Right. So again, from a societal standpoint as well as a personal standpoint, it's going to be very difficult.
Well, I thank you for painting that picture for us and helping kind of broaden the understanding of the impact here, not only people, but businesses in the community. I have two more questions, if I could. The next one is for Ms. Corlett. In New Hampshire, thousands of Granite Staters will no longer be able to afford health insurance if the Affordable Care Act enhanced tax credits expire. Can you tell us more about how taking away the enhanced tax credits will lead to health care cost increases for everyone, not just people in the ACA market?
Yeah, thank you for that question, Senator Hassan. So the really eye-popping premium increases are going to hit the 93% of people in the marketplaces who currently get premium tax credits. Their net premiums are going up, according to the Kaiser Family Foundation, by I think 113%. However, I think perhaps counterintuitively, people who are not eligible for those tax credits are also going to get a big premium increase. And that is because the insurance companies are assuming that the people most likely to give up their coverage due to affordability concerns are folks who are young and healthy,
Right.
who think they're invincible. And the folks that remain that are going to, squeeze their budgets to hang on to that health insurance coverage, they're going to be sicker on average.
Right.
And when you have a smaller and sicker risk pool, insurers need to raise their premiums to make sure they can cover those costs. So there are essentially these ripple effects. So even if you're unsubsidized by these premium tax credits, you will get hit with a big premium increase.
And it's fair to say, too, as people defer health insurance, defer health care, that when they do get health care, they tend to do it when it's more acute at more expensive sites like emergency rooms. That also drives the overall costs up.
That's absolutely right. What you'll see is people waiting to get care, showing up in the emergency room with much more acute or advanced conditions that cost more and are dealt with in much higher cost settings.
Well, thank you for clarifying that. And last question to Ms. Furman Simmons. The enhanced tax credit lower costs for families so that they can afford high-quality health insurance. That's the whole point. Can you tell us how these tax credits have helped you and your family access the care that you need? And you may have already said this, and I apologize because I came in a little bit late, but I'd love to just get it firsthand from you.
Thank you, Senator Hassan. It's a story worth telling over and over.
Yeah.
I think that both my husband and I were working full-time up until 2023. I actually had to leave my job at the University of Southern Maine, and we were both able to have plans on the ACA as a result of that. My husband's a mental health therapist, and we did not have to worry about having insurance for us and our two daughters as a result of the availability of those plans. Now, when I left my job at the University of Southern Maine, our income dropped, but we knew we could still have coverage. Which was very, very helpful. And this was a time when my need for care was going up. At that time, I was 6 years into MS treatment, and of course, I had continued degradation of the lesions in my brain.
Right.
And so I required a little bit more care, but we knew we had access to that care in an affordable way. Unfortunately, what has happened is that has, over time, we have decreased in, the amount of our savings. So we are in a position now where it's looking like it may become untenable for us if that premium increases significantly. So we have an exacting budget that we live on now.
Yeah.
And my hope is that we can continue to maintain and plan for that. But again, there's no margin for error. So thank you.
I appreciate your firsthand story. It's really, really important because this is all about making sure people can have health care regardless of what their situation is. So thank you so much. Again, Senator Shaheen, thank you for convening us. And I look forward to continuing to push for these enhanced tax credits, the extensions of them with you and with the rest of my colleagues. Thanks.
Thank you, Senator Hassan. Senator Blumenthal.
Thank you, Senator Shaheen. I want to join in thanking you for your leadership, not only in bringing us together today, but on healthcare affordability, providing a more permanent solution to many of these problems. I'm always struck in this building by how human problems and impacts can be reduced to abstract statistics. And for anyone who has gone to health clinics, as I have done as recently as just a few days ago, to renew my sense of reality, there are real human costs in children suffering, pain that is caused people. When you have an illness, there's a physical pain, there's a mental anxiety, and often people fail to get treatment because they think they can save money. And the illness gets worse and more costly, and people wind up in emergency rooms. So this failure to extend the subsidies and the premium tax credits is not only cruel, it's stupid, because ultimately the costs are raised. And Ms. Corlett, you have, I think, described, again, in abstract terms, how premiums are raised for everyone. when our health insurers in Connecticut were approved for double-digit increases, I said to my staff, you know, this is exactly the kind of abuse that I've fought as Attorney General. Let's call them on the carpet, let's lambast them. And they said to me, you know, they have a point. Because the healthier invincibles are going to say, hey, I don't need this insurance. And the sicker people are going to have to be covered. And that increases the premiums for everybody across the board. So it is cruel, but it's also stupid. And medical debt, as everybody knows, is the biggest cause of bankruptcy in the United States of America. When somebody goes into bankruptcy, a lot of people don't get paid money that they're owed. So those folks out there who say, well, you know, I got Medicare, I don't have to worry about this, I got a small business, I'm covering my people. They've got probably a lot of customers, a lot of suppliers who owe money to them, and they're going to go bankrupt. So ultimately, you know, everybody is going to pay in some way. Let me ask you, Mr. Joshi, your reaction to some of what I've been describing.
You're absolutely right about the impact on the emergency room. So just a little bit about us. We have 75,000 emergency room visits a year. That's 200 ED visits every single day. That's 8 people every hour. That includes trauma visits, motor vehicle accidents, gunshot wounds. Imagine individuals coming there for a sore throat, a cough, because they don't have insurance and they don't go to their primary care physician as a result. That impacts everybody. They're going to get great care, but at a much higher cost and to the detriment of the entire community. So completely agree that the impact is on everyone, and it's real life in terms of that. People should be able to get care when they need it instead of the last resort at the emergency room.
And new parents, I'm a new grandfather, and my third son and his wife have just had a daughter, and, you know, are grappling with this new experience, a lot of unknowns, and if one of them has a high fever and they didn't have insurance, they would wind up probably going to the emergency room because they wouldn't want to endanger their baby, and they're not going to care about a week later when the bill of $1,500 comes due for a fever that's easily treatable with an antibiotic from a physician if they would just go there rather than the emergency room.
It's absolutely correct. We need to provide access for everyone to the best setting of care, which is to the primary care physician office often.
Well, I'm very grateful to Senator Shaheen and all my colleagues for seeking to put a human face and voice as you are doing here. And I might just tell you, I don't know about this so-called spotlight hearing. You may feel that you're not having the same impact as if you were in a great big committee room. But the fact is that more people are watching you than would in a regular hearing. And I'm not exaggerating. These are numbers that come to us from the live stream that has gone out. Thousands of people are watching you right now. And so I'm really grateful to you for being here, and again to Senator Shaheen for putting it together. Thanks so much.
Well, thank you, Senator Blumenthal, and thank you for that reminder of all the people who are watching on live stream. And the reality is there are probably more senators who are actually going to join for this than many hearings, official hearings. So, and that's very good news, because what you all have to say is really important for everyone to hear. So we have been joined by Peter Welch from Vermont, another neighbor.
We're all suburbs of New Hampshire.
That's how we view it.
It is how you view it. I wasn't here to hear what you said, but I know what you said because I had eyes on what was going on here, and I really appreciate you being here. And Senator Shaheen, the combination of your leadership for small business, being governor and knowing what small businesses face, being governor and knowing what everyday families face. It's really shocking what's going on here in Washington, and you know that. But it's truly shocking to me that we're actually having a public policy debate about whether we cut health care as opposed to improve health care. And the theory of the case for folks who are in favor of this $1 trillion cut in Medicaid and now expiration of the credits that have been a lifeline, I read about your business, Mr. Baker, has at its core a premise that if you don't have health care, you won't get sick. So healthcare reform is taking healthcare access away, and voila, no problem. But we know that's not the case. And this $1 trillion in cuts in Medicaid, $150 billion out of the hospitals. It's not just $150 billion out of the hospitals, because all those folks who used to have Medicaid are going to still get sick and show up at our community hospitals and get treated, and our hospitals will provide that care as long as they can, but there'll come a point where they're bankrupt. I mean, that's literally what we're talking about. So your hearing here is focusing on these affordable care subsidies. And the other thing I want to say, this is not a situation where it's an optional benefit or an optional good that a person or a family can decide they want or don't want. If somebody in your family gets sick, you got to get care. You'll do whatever it takes, pay whatever you have. You'll get a second mortgage. You'll go into your retirement funds. You'll do whatever it is to take care of that person in your family, your child, your partner. So there's a cruelty to this policy as well as the total blindness. So, Mr. Baker, I saw the incredible interesting thing that your old company went from onto the Affordable Care Act, right? Yeah, just describe that. I mean, you probably did, Jim, but I think this is really a hardworking company, a successful business. A lot of people depend on these jobs. And what I've heard from employers, and I know you have too, Senator Shaheen, is that at the end of the year when you get hammered with that premium increase, you have this difficult conversation with your employees who are like family to you. And it's about, do you want us to pay the premium increase or but we can't give you as big a raise as we'd like to, or, there's that trade-off. So maybe you could describe that a little bit.
Well, as I said earlier, and thank you for the questions, Senator Welch, and I do know the difference between Vermont and New Hampshire.
Stop there, okay? She does enough bragging enough as it is about New Hampshire.
I did summer in Newbury. I really do know the difference. We played whack-a-mole with insurance costs. We've switched from provider to provider to provider for years, trying to manage the input costs of health care, not only for the business where we contribute half to our staff, but also for our staff. We need healthy staff. We don't want them to take time off to be ill. We're a small organization. We want to encourage their healthy life everywhere we can. It's good for us. It's good for them. It's a virtuous circle. The latest rate last year came in from Blue Cross Blue Shield at an increase of 34%.
It's unreal.
Largest one I've seen in close to 40 years. It was a real shocker. And we're a small organization. We're flat. We have talked about health care person to person for 25 years at least. And so I gather the staff and say, hey guys, what are we going to do about this? I don't have any control over this. Let's talk it out and choose a course. Obviously the staff was stunned, and there was some trepidation about switching to the ACA. There's a lot of unknowns. No one had really considered it. It was a bit complex for me to work through some of it, but it's a complex situation. It's a complex offering. And the staff decided that, okay, we're going to accept the company not offering health care. We're going to accept that the company's going to pay us, and then we're going to go find health care. And my office manager, God bless her, walked my staff through this. She's been on ACA support for a number of years. It's been a very healthy thing for my staff. We moved them from a bronze plan to a silver plan and gained dental. So great advantage to add this to our benefit offering, and we very much hope we can maintain it next year.
Thank you, Senator Welch. We have been joined by Senator Klobuchar from Minnesota. Senator Klobuchar.
Thank you. Thank you very much, Senator Shaheen, for holding this really important spotlight hearing, and to Senator Welch. He and I, for years, have been leading the prescription drug negotiation Medicare bills, and we finally got them passed into law a few years ago, and the first drugs came out for negotiation. I know you're all nodding your head because it was like a game changer. Eliquis, Xarelto, and Januvia, Jardiance. I just like to name drop the drugs that I know that at a healthcare hearing, whatever. But now Bernie Sanders just did a report as ranking member of the Health Committee here in the Senate, and showing over 600 drug prices are now going up because the action has pretty much stopped on a lot of this. And I think it's something to keep in mind as we talk about healthcare. But I want to focus right now on what's in front of us, and that's, Ms. Corlett, the argument that our Republican colleagues are making that, hey, we can just wait on this. We need an off-ramp. I keep thinking our people are standing on a cliff right now, our businesses, our farmers, our individuals, and they say, well, you know, December, maybe we can do it at the end of the year. Could you explain why this is not a December, January thing, it's a now thing, and what waiting would do to the premiums?
Yeah, absolutely. And I'll just start by saying I think it's important for folks to remember that participating in the marketplaces is an entirely voluntary decision on the part of insurance companies. There is nothing forcing them to participate. And when they're operating in an environment with this kind of uncertainty, it's causing some of them to say, wait a minute, we're maybe not going to participate, or we're going to reduce our service areas and maybe not participate in the full state. So that's the first issue. They need to decide, actually very soon, like if not today, whether or not they're going to sign contracts to participate in the ACA marketplaces. We've already heard about some big companies like CVS, Aetna pulling out of the marketplaces because of the policy uncertainty. The second issue is, as you mentioned, Senator Klobuchar, the premiums. Those are going to be locked into place, and insurers are baking into those rates the fact that they are expecting a smaller and sicker risk pool, and that they are dealing with a lot of this policy uncertainty, not only due to the enhanced premium tax credits going away, but also because of H.R. 1, the budget reconciliation bill, and some of the changes stemming from that. So once those rates are locked in, they're locked in for the full year. And there's sort of that point of no return that we are going to be at very, very soon, and long before December.
Thank you, Senator Klobuchar. This is something that I've actually talked to my neurologist about what would the safety be? Could I cut my pills in half in case of emergency and I can't necessarily afford to get more medication? And the simple answer is no, I cannot risk it. It's one of those things where I am carefully managing the pressure in my brain right now. Anytime I miss a dose, I think, ooh, am I contributing to that pressure elevating? am I contributing to continued neurodemyelinization, meaning that that is irreparable damage that's happening to the nerves in my brain? If I wait, then I move closer to disability faster. So MS is a disease of not if, it's just when. And it's very difficult to say, oh, if I skip it now, maybe I'm going to be okay for a couple of days, but down the road, I will limit the amount of time that I have for vision. I will limit the amount of time that I have for mobility. So it's very difficult in this particular disease state to think about that kind of management. And luckily, as I mentioned a little bit earlier, I'm on a very cost-effective medication. I do have some contingency budget for that, but not a lot. And it's one of those things where, again, I am always in a position where I'm constantly having to navigate calling potentially the pharmaceutical company and saying, can I get another coupon? What is available for samples, things like that. So it's a difficult one. And I know for other patients who are in chronic diseases and taking cutting edge therapies, especially the biologics that are available, you can't skip those treatments. Yeah, thank you.
Dr. Joshi, one of the things, I was just on this 13-county rural tour, and I met with some of our hospitals who are already on a thin margin, and I knew they would talk about Medicaid and Medicare, of course, with the $500 billion Medicare cut out of the bill. Yeah, thanks, Jean. Out of the bill, because it's so profound what I'm saying. Yes, thank you. But out of the bill this summer, the Medicare and the Medicaid cuts, but I was surprised at how many of them brought up this Affordable Care Act tax credit, because in rural especially, you've got 27% of farmers are on this, bunch of small, much smaller companies than we may have in the Twin Cities. And so they're apt to be on this more. Projections are a double of premium. So what did the hospital say? This is the connection I didn't make. They're saying, look, this is a huge deal for us, because if people don't have insurance, we're already operating very thinly. They're not going to, one, come in when they should, and two, they're going to come in with really serious problems, and then we're not going to have the margin to be able to take care of them like we'd like to.
That is true, Senator. And in fact, in rural communities, they generally have fewer coverage options as well. And our per capita income is lower than the rest of the country. And thus, that's a double whammy in terms of their affordability, which does impact hospitals. We are already, and some are negative margins, not just razor thin, and we are the anchors for our community. So it's a big impact.
I see my colleague gotten here, so Mr. Baker, I'll just say a line you might want to use that one of my small farmers and at the same time business owners, because they're always having to be in like the gig economy, used. He said that with the tariffs, with all of the input costs going up, and then this healthcare problem, it was a perfect storm of ugly. So there you go.
Thank you for that, and I feel for your farm communities.
Yeah, thank you.
An excellent quote, Senator Klobuchar. Senator Hirono from Hawaii has joined us, and I will turn it over to you for questions.
Thank you very much, Senator. Thank you. The spotlight hearing is really important, because what could be more basic than healthcare costs? And I come from a family where, as an immigrant, my mother had low-paying jobs. She had absolutely no job security when we first got here. We lived in a one-room boarding house where the three of us slept sideways on one bed. I know what it's like not to have health insurance or health coverage. And my greatest fear as a child growing up in this situation was that my mother would get sick. She had no health care coverage. And if she got sick, she couldn't work. And if she didn't work, she wouldn't get paid. We literally, even when she was working, I tell you all this because I think it's really important for those of us who sit here making these decisions to understand what it's like for American people not to have this basic kind of coverage. So my greatest fear was my mom would get sick, couldn't work. We literally wouldn't be able to pay rent. I mean, even when she was working, we would run out of money by the end of the month. So I know what it's like. Also, I grew up in a very rural part of Japan where we didn't have, I would say, adequate access. Access, very important, affordable and access to healthcare coverage. And my baby sister died of pneumonia in Japan as a result of lack of, in my view, lack of healthcare. So I know what it's like. And for us to sit here and have to address this issue of millions of people who are going to get kicked off the ACA because we are not going to continue the tax credits. You know, when you talk to the Republicans, it's like you want to say to them, what world do you live in? That we can give continue the tax credits to the billionaires who are not even asking for it. That has to continue. But when it comes to the tax credits for the ACA to make healthcare affordable for millions of people in our country, it's like, oh, well, it can't be done. It just makes my head explode. So one of the questions I have is, thank you all for testifying. And this is for Christian, for Ms. Simmons. Thank you for sharing your story. I'm sorry, I can't even see your thing. There you are. Okay. So I think it's really important that you came here to share with us that if the ACA credits expire, you have estimated that your monthly premiums will cost $2,000 or $24,000 a year, and that's a huge hit to your household income. What decisions, what sacrifices, what kind of priority changes do you anticipate having to make in order to continue to afford these higher premiums?
Senator Hirano, thank you so much for asking that question. We actually made a correction based on the current data from the Kaiser family calculator. It looks like premiums are actually going to be going up about 118%, and that $2,000 reflects the yearly premium, which is opposed to the monthly premium. So just for clarification on that point.
So what are the amounts I'm supposed to be looking at?
Sure, no problem. We currently pay $11 a month for our premium, and we would go up to roughly $2,000 a year, potentially, if not more,
So
for
do you
the
think
total
that
in total. So just for that clarification. So
okay, thank you for that
Of course.
clarification. So I think that it's pretty important that we use the correct figures, but this is still, $2,000 is a big jump.
it is
For your family. So what do you anticipate you're going to need to do? You're going to have to get another job? What?
So that's a great question. The current treatment that I'm in with multiple sclerosis makes it fairly difficult for me to hold a full-time job. I am able to work part-time. I teach part-time, and that's been incredibly helpful. I also teach, though, with the proviso that if I have an MS flare-up or if something happens to me, that I have to cancel that. So it's not necessarily guaranteed revenue for me. So the only thing that we fully depend upon is my husband's salary. So we plan our budget around that salary.
So what could very well happen is that what happened before the ACA was put in place and some 20 million plus more people suddenly, I shouldn't say suddenly, had health insurance, but we're dealing with a Republican Party they have been trying to get rid of the ACA since the very inception. And while this may be statistically not validated, I don't know. I think there's a connection, and this is something that maybe Ms. Collette can respond to. But the unexpected major medical incidents would occur to people who didn't have health care coverage, leading to personal bankruptcies, which I think have gone down since the inception of the ACA. And so thank you. You're going to have to make some very tough decisions in your situation. For Ms. Collette, you're from Georgetown, right? You do
Yes.
research. Okay, so what do you expect will happen when some 5 million people will no longer be able to afford the Affordable Care Act? They will be bare in terms of health care. Where do they go, and what will be the domino effect of millions of people who will be in the system, so to speak, but without health care coverage? Can you talk about that a little bit?
Yes, absolutely. Thank you for the question. The literature on this is very, very clear. People who do not have health insurance, they delay or they forego care, meaning that they often wait too long. And when they do finally get health care, the disease condition is advanced, their prognosis is worse, their health outcomes are worse, they're getting care in much higher cost settings like emergency rooms. We also know it will lead to an increase in medical debt, threatening the financial vitality of families, and more uncompensated care costs for providers. The other point I think is really important to make is a lot of folks who hang on to their coverage to pay those will need to switch to higher deductible plans, and that will increase their financial barriers to accessing care, also increasing medical debt, also increasing uncompensated care costs for providers.
So when you talk about, do you mind if I continue? So when you have uncompensated care, what are the for example, are people who have regular non-ACA marketplace health coverage, are they going to see their premiums go up as these hospitals and healthcare providers have to take care of people who are going to their ERs without healthcare coverage? Is there going to be an impact?
Well, the cost to the system, and I think Dr. Joshi, is that Joshi? Has spoken to this really well, but I think the cost to the system will inevitably go up as the numbers of uninsured go up, and certainly for employers who are struggling to afford healthcare for their workers, they are also going to be dealing with higher system costs.
So it's not as though our healthcare system is working perfectly. I mean, there are a lot of us who would like to see some other changes. But on the other hand, we have it provides coverage for people. It may not be perfect, but the Republicans want to even take care of that. If any of you have any perspectives on what we can do to at least restore the credits to the millions of people under the ACA marketplace that are relying on these credits, I would be very eager to hear your suggestions. Go ahead.
I may dive in on that one.
Yes, please.
I think I'm a little sad that the press has not covered this issue with the level of drama and urgency that they're covering other issues. I think this is one of the most significant things the country faces from a human perspective and a business perspective and a reinvestment in our communities perspective. I don't know how you raise that alarm with the press. I think the only thing that we as citizens can do is to continue to write on social media, to continue to write letters to our editors. We're fortunate in New Hampshire to have two senators who are very thoughtful about the issue, so we don't really have to write home. But I think there's a lot of folks in the country who could be encouraged to do that, and given the power of social media, perhaps they can do it quickly and have an effect.
And I would just point out we've had a number of reporters here covering this hearing, so hopefully they will do some of that reporting that will help people understand what's coming.
And it's coming as soon as October 1st when the people in ACA Marketplace start getting their notices to start preparing to make some decisions regarding their coverage, because without the credits, their costs of the ACA coverage will go way up. And I think all of those stories need to be told and amplified, and each of you can help us do that. Thank you very much.
Thank you, Senator Hirono, and thank you for your passion on this issue. I think all of the senators who we were expecting have shown up. We had a few cancellations because of other events, but I really appreciate, I know we all do, all of the testimony from each of our panelists. It is really important to, as you pointed out, Jeff, to raise this issue in a way that the American people understand what's happening so that they can help encourage their elected officials to address it in a way that's good for all Americans. So thank you all very much for your ongoing good work, and we will keep at it here in the Democratic caucus to try and ensure that we can extend these tax credits. Thank you. This hearing is now closed.